All right, wake up, pre-health sharks. It is time once again for our monthly webinar, Wake Up Pre-Health Sharks, where we tackle various pre-health topics, we give guidance to students, and we interview great guest speakers like today. And so we have an exciting topic for today, talking about physician assistants. But before we get into our guest speaker and our topic, I'll let all of our panelists introduce themselves. My name is Emilio Lorenzo. I'm the Associate Director of Employee Relations for the Center for Academic and Professional Success. And I'll turn it over to my colleagues who are going to introduce themselves.
Hi, everyone. My name is Gabby Gross, and I'm an Edge Advisor in the Center for Academic and Professional Success, and it's exciting to be back this month.
And hello, everyone. My name is Daniela Crocky Suarez. I go by Danny, and I'm one of the career advisors over in CAPS. So I'm also super excited to be here and with one of my favorite guests that we have.
So as we mentioned, we have a lot of great topics. Today, we're interviewing a physician assistant student. Haley Diaz is our guest speaker. So we're really excited to hear from her and get her insights about her journey into PA and dive a little bit into the industry and learn about her experiences. But I'm going to turn it over to Haley to see if she can introduce herself and tell us a little bit about her background, her story, and then we're going to put her in the hot seat later and ask her a few questions.
Hi, guys. Good morning. Thank you so much, Emilio. So as you guys know, my name is Haley Diaz. I'm a current first-year physician assistant student at Miami-Dade College. I started my college education at Nova Southeastern University, and I hold a bachelor's in psychology. I also have a concentration in biology. Nova really helped prepare me for what I'm dealing with today, all the courses and the rigor. I honestly would not be where I am today if it wasn't for the career development faculty and just the whole team over there, especially Danny. You guys and Emilio, you guys have been so helpful, and Gabby was always there to listen to me and help me through any issues I was going through with my classes. So you guys have an amazing support system with career development, and I really just encourage you guys to use all of the resources you have, because a lot of colleges, especially the college that I'm at now, they don't have the same resources, and I've learned. So I really truly feel blessed that I had the opportunity to go to NSU and just connect with your peers, speak to your faculty, and engage in outside activities and courses that you can to prepare yourself if you're interested in going into a health profession.
Awesome, Haley. Thank you so much. So we do have a lot of questions for you, Haley, and picking your brain on your journey, things that assisted you and things that you've experienced as a PA student. But we thought we'd kick it off by giving an overview of what a physician assistant is and does. So a physician assistant, or PA, are medical providers who are licensed to diagnose and treat illness and disease and to prescribe medication for patients. It's an ever-growing field, something that you're seeing a lot more in different clinics, hospitals around the country. It's definitely a very booming career. You can work in physician offices, hospitals, clinics, I mentioned. The physician and PA relationship is fundamental to the profession and enhances the delivery and quality of healthcare. This is why you're seeing them so more prevalent in private offices and clinics. They treat patients with significant autonomy, so they're very much at times looked at as physicians. And physician assistants also work in specialties outside of primary care, which could include medical and surgical specialty and subspecialties. So that's a brief introduction of the field, but definitely a great option if you're looking to get into healthcare, work autonomy, and have a lot of the same things that a physician can do with patients.
All right, thank you, Emilio. So we want to go a little bit more into the roles and requirements as well. So physician assistants in a primary care setting can provide nearly all the same services that a physician does. There's just a few differences, and I'm sure Haley will go into that too when we ask her some questions. But they take medical histories, they perform physical exams, they order and interpret laboratory tests, they diagnose and treat illnesses, like Emilio was saying. They counsel patients, they set fractures. And then I wanted to leave assist in surgery for last, because this is really, a main difference in being a physician and being a PA, is that They just assist in the surgeries. They do not perform surgeries. So PAs are always working in conjunction with physicians. And to practice as a PA, you have to graduate from an accredited PA program. You have to pass a certification exam, and then you also have to obtain a license in the state that you want to practice in. So that's important to keep in mind if you're one that likes to travel, one that likes to or wants to live in a different state. So yeah, that's a little bit about the roles and the requirements.
Awesome.
Yeah, and I'm so excited and honored to get to ask the first question to you, Haley. Haley is someone I was so excited to get to work with as a student and even as one of our employees in the office. So seeing where she is now and the work she's doing both in the field and on social media always makes me so proud. So you'll definitely hear more about it. I'll start off with the first question, Haley, which is, why did you choose PA over other healthcare careers? And do you have a specialty in mind? Because I know there's a numerous amounts that people can switch between in the field.
So, as you guys in career development know, how many times I changed my mind. Originally, I had started as a pre-PT. And I love physical therapy. I'm a huge advocate for physical therapy. I decided that I didn't want to go into PT because I really loved the clinical aspect of medicine and be able to diagnose and treat. And so that pulled me more towards DO, MD. And at one point, I did have a seat in the DO program at Nova as an undergraduate student. As I continued to shadow and I continued to learn about the difference in roles and the length of time it takes to become a physician, I decided that PA was the best for me because I was just very happy with being able to go to school for an additional 27 months, have basically the same roles and responsibilities, but also have somebody that I can work off of, somebody supervising me. In PA, there's a misconception that the supervising physician is always there. That's not the case. A lot of times PAs do work autonomously, but I think it's wonderful to always have someone that you could say, hey, I'm not exactly sure about this. Could you give me some more insight? Because they have that training, right? I also love that PA is centered on the patient. You're there for the patient. You're there to educate the patient. We're also there to fill in the gaps in healthcare. As you guys know, we have a physician shortage in America, in Canada, and in many other countries. That's why the role of the PA was created, to help fill in those gaps. So I'm very happy and just blessed to be able to be in a position where in a few more months, I will be able to contribute to that and hopefully minimize the disparities that there are in medicine. Now, in regards to a specialty, I personally love orthopedics and rehabilitation. So as a PA, I would be able to go into that specialty. I also love neurology. So one of the reasons why I love PA is that lateral mobility. That's one of the reasons why I picked PA. As a physician, you have to match into a residency. You have to become board certified in usually one specialty, and that's it. That's your specialty for the rest of your career. That's not the case in PA. You can have multiple jobs at the same time in different specialties, or you can move around as you progress through your career. So that's why I chose PA.
That's great. Thank you, Haley. And I know I have a number of my students even here who are considering also med school or PT or OT. So this can help maybe narrow down like what kind of path might be best for you.
Yeah.
So to the second question, what healthcare experiences prepared you most to go through the PA school application process?
So I became a pediatric phlebotomist. Now, in order to do that, the summer after my freshman year of college, I enrolled in a 3-month program and I had to pass like a licensure exam, and I did. And then I started working at a pediatric office, and that was very scary. I was 19 years old and I was poking babies in in front of their parents who are angry, like, my baby's crying, what's going on? That really taught me to grow my skin a little bit, not get so, anxious, kind of handle that situation. And it also exposed me to being on the floor, which is what they call, because you're not a provider, but you're a tech and you're helping, you're providing support. I think before you go into any profession, you should know a little bit about what everybody else does. Because yeah, it's great. You could become a doctor, you could become a PA, but you're not doing everything by yourself. You need a lot of help, and you need to be able to be humble and respect those other people that you're working with and know what they do. So that to me was invaluable. That was a huge experience. And from there, I just continued to grow and move on. So I really encourage you guys, just because something is not offered at school or you don't see it readily available, please do some research if you're interested in it and say, how can I make myself better? Because even as a regular civilian, let's say you don't go into healthcare, everyone, in my opinion, should know CPR. So anything that's going to make you better as a person and as a future graduate student, I encourage you to do it and to look into it.
Thank you, Haley. That's awesome advice. And I feel like it encourages, getting that different perspective within healthcare because it's so broad. So I really appreciate that.
And really interesting ways to gain. Students are always wondering, well, how can I get direct clinical experience before entering a professional program? And I think you talked about a great route. And, a lot of these routes to gain that experience comes with a little bit of nervousness, doubt of how am I going to be able to do this? And I think immersing yourself in those settings and learning, and it can only benefit you down the road. And I completely agree with you, Haley. Like, everyone should be CPR certified before going into these programs. It just teaches you skills that are the basic foundations of what you need in the career.
Yes.
All right. And question 3, which I was very excited about to pull one of these pictures. Can you tell us about your role on social media as a pre-PA mentor and a healthcare advocate?
So this was something that kind of just happened, and on my spare time, this is one of my outlets. I originally started as the petite PA, and I noticed there was a lot of health providers that were on Instagram showing how they got to where they got and helping others. And so that's where I started. And then I realized I learned a lot and I hit a lot of walls and I failed a lot to get to where I am. So why not help others maybe minimize, hitting some walls, right? And so that's why I decided to start my page. And now I mentor pre-PA students. I communicate with PA students across the country. And this was also a great opportunity for me to network with current PAs. I already had a PA offer me a job opportunity when I graduate. So a lot of time people think, oh, social media, like that's silly, that's stupid, but if you focus on the right aspects of it, professionalism, networking, that's all very important. And that's going to help you in your career moving forward. And you can start that whenever you want. So that's another reason why I started this. The last reason, which I recently started, is I have a chronic illness and disability, and I don't see other students in my class, going through the same thing. And I wanted to see if there was other pre-PA students or pre-med students going through the same thing, because I thought, wow, I'm not going to be able to become a provider if I have these issues. And that's not true at all. So now I'm connecting with these other individuals, and it's just been very inspiring and very nice. So I'm very blessed to have the small platform that I have. I enjoy it.
I think you're doing fantastic. I love following your account and seeing even the advocacy you do for learning basic things like, hello, how are you, in different languages. I think different things like that can make patients feel really comfortable around you. So you're doing fantastic.
Yeah.
I was going to say, Haley, I love your Instagram too. I always get so excited when I see your posts. And I love that you said that you hit walls. Like, no one path is linear. And I think a lot of undergraduate students need to hear that from someone like you who's gotten to where they've gotten, with overcoming certain bumps and challenges. So thank you for sharing that.
I reiterate what they said. It's so cool how you've been able to mentor, provide your insight. I also think it's awesome how you've been able to showcase that even getting into healthcare, you're building a brand for yourself. Whether you decide to work in a hospital or a clinic, you now have basically words that other professionals in the field are already associating with who you are and your brand in the profession. And so it's never too early to start off, and you never know what doors that's going to open up down the road.
Exactly.
So Haley, moving down the line, what are the necessary characteristics and attributes that make a successful PA? Like, what would you say are kind of the foundations or the main skills you need to be successful in this industry?
So I'm still learning these. And I think that that's very important for everyone to know. You're not going to know everything. Even when you graduate and you have that PAC, you're not going to know everything. You're constantly learning. You need to be humble. You can't be arrogant. You need to be patient, and you need to remember that you're putting the patient first. It's always about the patient. That's honestly, and this is something that's always said, but if you are a PA, it's all about teamwork. But honestly, for me, that's any position. Even when you're a doctor, you have to work with hospital administration. You have somebody telling you what to do. We all have bosses. So it's just very important to always be professional, to communicate, and to always work as a team. Those are characteristics that are very important. And I'm sure there are many others that I will learn along the way.
Being adaptable. I think everything you mentioned,
Yes, you
great
have to
skills.
be
And
able to adapt.
yeah, so this definitely the essence of it. And patient care, because at the end of the day, no matter what area of healthcare you go into, patient advocacy and putting your patients first. I mean, that goes with all these other skills you're mentioning, Haley. So that's awesome. Um, can you describe what your academic and clinical experience look like now that you're in PA school? Like, walk us through a little bit on the academic rigors as well as the clinical rigors that you're going through.
So as a PA student, the first year is purely didactic. You don't really do too much on the clinical side. However, we do have clinical skills lab where I learn how to auscultate, how to percuss, what I'm listening for, what I'm looking for. So that we all learn during didactic. Didactic is known as didactic because it is a lot. It can be very stressful, and that is what I'm going through right now. I'm about to finish my second semester of 4 of didactic. In regards to clinicals, we will be starting at Jackson Hospital, I think through the Veteran Affairs branch next semester. So I'm looking forward to that. We get a little taste before we start our rotations in August of next year. So not too much to report yet on the clinical side, but I am really looking forward to it. It's a full year and you spend about 1 to 2 months in each specialty up until you graduate.
Perfect. And what have you heard from maybe upperclassmen that are going through clinicals? What insights have they given you about the clinical experiences?
They really love their clinicals. We have an elective rotation where you can pick essentially where you want to rotate in if you haven't already done it. So for example, we do the mandatory ones are emergency medicine, OBGYN, family, internal medicine, pediatrics, surgery is mandatory. And then there's one more that I'm forgetting. So we go through all of those rotations and they love them. Oh, psych. We do a psych rotation at the VA. And it teaches them like, oh, I think I can handle this, or no, I don't really like this. It allows them to gear. And again, this is where our upperclassmen network, because if they go well with the preceptor, they form a relationship, it goes well, guess who has a job opportunity right after passing their boards? So this is all things to keep in mind and just very important.
Absolutely. So Haley, what should someone know before they decide to become a physician assistant? Like you mentioned, you were on a PT route and you changed kind of the focus for your healthcare career. Tell us a little bit about things that students should do to confirm this before going to PA school, and what they should really know before even jumping into that type of career.
Number 1, you should shadow, because if you don't like what you're seeing, if you don't see yourself doing that on a daily basis, it's probably not for you. Now, just because you see one physician or one PA or one PT and you're like, I don't know about this, that doesn't mean you should give up and stop trying. You should probably go shadow another one, right? You should have different experiences with mentors shadowing. Something that I also recommend is you should take a CPR class. You should try to take maybe a CNA course. Does that scare you? Do you think you can handle it? Do you like it? If you don't like it, then that's telling you something, right? So that's very important. I also recommend you know the difference between a PA and an NP and the roles and responsibilities between the PA and the physician. Are you happy with that? Are you just chasing becoming a doctor because you want to be called doctor? Or are you happy with, the roles and responsibilities that they have? So that's all something to take into consideration. That was something that was asked to me in my interview. They want to make sure that you're happy with your role. It's very important, because what happens? You spend all this time going to school and then you're not happy and you go back to school. So just be aware, immerse yourself, learn about the positions. That's my advice.
And you mentioned shadowing. Any advice for students on getting those shadowing opportunities?
So I would send emails. I would create a template. Hi, my name is Haley. I'm a current student at NSU. I came across your page, your website. I wanted to know if maybe you could have me come in and shadow. Once you get your foot in the door, which is a technique they teach you in psychology, it's called the foot in the door technique. Once you get in, you form your relationship, you keep shadowing. You need a letter of rec because you have a relationship, they'll write you a letter of rec. Oh, you know what? I know a physician or a PA in this specialty. Would you like to shadow them? Oh, yes, that'd be great. And like that. So it's not just about getting good grades and doing well on your exams. It's about networking. I'm always going to push that. It's about forming relationships with your mentors, preceptors, and anyone else that you may know and come across.
Some excellent tips there. Absolutely.
All right, this is me. Sorry, guys. So Haley, tell us, what are some of the most challenging moments that you've experienced so far as a PA student, and what did you learn from those experiences?
So my answer is going to be a little different because I started PA school during a pandemic.
True.
Yeah, but basically time management. You need to be able to say, I'm going to study for this set amount of time. Even in my interview, they asked me, okay, you're not doing well in a class, let's say scenario, and that exam is worth 25%, but you have another exam coming up and you have an A in that class and it's worth 10%. What are you going to do? The answer was, well, I have to spend more time on the exam that's worth 25% and the class that I'm not doing well in. So you have to be able to look at everything, percentages, how well you're doing, what you're studying, and manage. It's a strategy. PA school is a strategy, and that's what I've been learning. And that was the most challenging part for me over the summer. And thankfully, I've been able to implement it during fall. Also, you're not going to pass every exam. It's just most people are not going to pass every exam. You are going to have an exam where maybe the passing score is a 75 and you get a 74 and you have to go to tutoring. My very first exam in PA school, I bombed it. I had to go to tutoring. But guess what? My next exam, I got an A. And the one after that, I got an A because I learned and I didn't beat myself up over it. Did I hang the 73 on my wall and be like, Haley, you need to really get it together? Yes, I did. But then I got it together. So just don't be hard on yourself. Look at where you can be better. Make a plan, adapt, move on. You're always reevaluating what you're doing and how it can be better.
Thank you, Haley. I really appreciate just you being so realistic and open with us today, because I think it's important for students to hear that, and even for us as advisors to hear that when we're advising our students on these type of things. Something that I don't think is a question that I do want to touch on, Haley, is that I do notice on your Instagram how close that you are with your cohort. Can you talk to us a little bit about like how that helps you with challenging moments?
Of course. So, there are times, for example, last night, I had watched videos and I still did not understand something when it came to EKG because we're learning how to interpret EKGs. I called my classmate Hans. Hans said, okay, I'm going to teach you this in 10 minutes. And then he reviewed questions with me and I understood it and I move on. Everyone in our class, since we all were in different specialties, we can help each other. We go through modules. That's how my curriculum is set up. So every 2 weeks we have a new subject. For example, this week I'm in hematology, but last week I was in cardio. So there are other students who were in cardio. I was in ortho. So if somebody has an ortho question, they'll be like, hey, Haley, what is this? What's going on? And the other way around. So PA school, because you're not competing for a residency slot or being the top in your class, it's really not cutthroat. It's really a family. And I love that. We're all helping each other. We want to pass and we want to see everyone do well. So I'm really thankful for my classmates for that.
That's awesome, Haley. Thanks so much for sharing that, because I really get so happy when I see, all of you guys studying together, hanging out, because I think it's really important to lean on each other while you're going through this program. So thanks.
Definitely. You need someone to go through the program with.
All right. So our last question for you is, what lasting advice do you have for students who are interested in becoming a PA?
Always do your research. Something that is not always brought up is check the price of your program. Okay. My program is one of the cheapest programs in the country. And I still rotate with students that go to University of Miami, FIU, Barry. I still get to rotate with everyone else, but I'm going to be able to pay off my debt faster. That's something that they don't tell you about, right? The average cost of PA school is anywhere between $70,000 to $90,000. Now, if that's not a big deal, if you don't care, which I love NSU, I would have loved to go to PA school at NSU. I really wouldn't have cared about the cost. But, I got into MDC and I'm paying $30,000 for my master's. So I'm going to be able to pay that off faster. And that's something to look into. Lastly, again, do your research. Expose yourself to these different positions. Talk to PA students, talk to med students. If you're not sure, that's okay. It's okay to not be sure. I didn't firmly decide on PA route until end of junior year. And by that point, I had already taken orgo and physics and all those challenging classes. So it's okay. That's my advice.
Thank you. I appreciate it. I know we didn't have a question about tuition, but I really appreciate you bringing that up because a lot of students, I think, have in the back of their mind of how am I going to pay for things? What should I be looking at? So thank you for sharing your experience.
So Haley, thank you so much. We're going to turn over to students, see if you have any questions. But again, Wake Up Pre Sharks, something we host on a monthly basis. And we have great guest speakers like Haley today, who was so generous to not only give up her time, but share her experiences. But our office, the NSU Center for Academic and Professional Success, can guide you in your pre-health options, be able to give you guidance either on career exploration, resume development, gaining some of the experiences that Haley gained prior to entering PA school, help you plan strategically so that you can apply strategically. And that include personal statement development, the application itself, helping you reach out for shadowing opportunities. And so we have our information here on how to schedule an appointment. And if you want to look over this recording, we put it on our YouTube channel. But before we wrap up and thank Haley one last time, do any students on the call have any questions? Feel free to unmute yourself and be able to shoot a question out for us today.
I had a question about MDC. Is like the program there relatively new? Because I haven't heard much about it until I researched it.
So no, MDC is not a new program by any means. It's been around since the 90s. Most of my professors are actually MDC alumni. So I'm being taught by the faculty that went to my school when they were PA students, which is pretty cool. It's not a new program at all. It's just not commonly like advertised. For example, MDC doesn't use CASPA. If you guys are aware with CASPA, that's where you submit for most PA schools. They have their own application system, and it's fairly simple. But if anyone has any questions about MDC specifically, you can always message me on my Instagram page. I'm more than happy to help you guys out with that in the application process.
Haley, we got a question on the chat. Do PA schools require a research or a research experience before entering the program?
Hi, Stephanie. So usually no, it really depends on the program. It's a program by program basis, basically. My school, for example, did not require that.
Any other questions from students?
Did you meet with like any admission counselors for advice on how to make you maybe a more competitive applicant?
Yes, so I always spoke with Emilio, Danny, Nick at the time, Gabby, literally everyone at Career. I was speaking to them and they were giving me advice. And I was doing research and speaking to med students, PA students on what I can do to stand out. And that's what I did.
Okay, thank you.
We do host
Love your advice, by the way.
And we do host graduate and professional school fair where we have admissions counselors on hand. So that could be an additional route. Our team could definitely help you apply strategically, but sometimes speaking to admissions counselors for your programs, not being shy to be able to go in there and ask the questions you need.
I think we got a question from Maya, if I'm saying her name correctly. So HCE is basically healthcare hours, right? But healthcare hours are not the same as PCE, which is direct contact patient hours. So in order to have direct contact patient hours, you have to work, you have to be paid in a position in healthcare. So for example, that would be a medical assistant, PT aide, phlebotomist, so on and so forth. Those are direct patient care contact hours. Most schools also recognize scribing as direct contact hours. I was a scribe at one point as well. The healthcare hours is anything more administratively. So patient advocate, which I was as well, jobs like that is not hands-on patient hours, patient care. MDC does this accept scribe as direct patient care hours, yes. CNA, I actually recommend CNA, Stephanie, because now the phlebotomy programs have been changing. So in most programs now you have to be in school for a year. to be a licensed medical assistant, you also have to be in school a year. That's very complicated when you're a college student, full-time college student. So CNA classes, you can do some research. You can also reach out to me because I do help people find direct patient care hours in their area. Usually it's about 2 weeks, or you can take a test that you can study for like over the weekend, over holiday break, and then you can become a certified nursing assistant. I think it's a great opportunity and also gives you a little bit insight into nursing, which is always nice because we're going to be working with nurses. Oh, that's awesome. Congrats.
I think we got one more question, Haley. I would like to shadow in the hospital, in the NICU. Would that be possible? Like even shadow in a neonatal PA?
It is possible. However, given the restrictions with COVID, not likely at this time. There are a lot of PAs that are doing virtual opportunities on Instagram. I try to share them on my page whenever I see them, but you can always reach out and ask one if you know one, if they'd be willing to do some virtual shadowing hours, and you can get like a certificate of completion showing that you did do that. In regards to the hospital, just in general, depending the hospital, they may or may not allow you to shadow just because that is their policy. So I always advise students to start with private practices and outpatient centers before they go into the hospital.
Awesome. Haley.
So I actually made a list, Stephanie, like an Excel sheet, and I would say like time in, time out, where I was, and I would get my physician, because I did shadow a lot of doctors, physician or PA signature. I also shadowed PTs. So all those hours I'd get signed off. However, when you do submit this on CASPA, it is done on an honor system. So you do put the phone number of the place where you shadow, but you know, they might call and verify, they might not. So you just have to be honest when you are submitting your hours.
Haley, I have a question for you. I know you keep bringing up your Instagram, and I know most students do have Instagram, but just in case they don't, is there another way to get in contact with you, potentially an email that you can place in the chat, or I can place?
Yeah, I'll put my school email in the chat right now.
Thank you.
And Haley, I know this can fluctuate state by state, but
Mhm.
for those that maybe are wondering, and I know you're still in school, but what's the average pay for a PA in the industry, if you've seen that?
Yes, of course. I always look at that. So it's gone up. It's about $104,000. Yeah, 104. My school personally, we have a professor who works with the incoming new grads, and he always tries to make sure that we start at 100. He won't let us take an offer if it's under 100, because he says that he's selling us on our skills, not on our experience. Because at the end of the day, we have those skills. We just need to learn how to use them properly. So that's very important. You guys can always look up, you know, highest PA states, paying states, and the specialties, but Durham is usually the highest specialty. And then you have surgeries, neuro, ortho, so on and so forth.
Awesome. Thanks so much, Haley. This has been super helpful. Thank you so much for taking the time, sharing your insight, answering all these questions. And thank you to the students being able to attend and listen to Haley's insights. Definitely follow her on Instagram. A lot to be able to be gained by gaining that insight from her. So Haley, thank you again. We really appreciate you jumping on the webinar with us today.
Thank you to everyone who came. Thank you, Danny. Thank you, Emilio. Thank you, Gabby. I miss you guys. If it wasn't because of COVID, I'd be going more often. And everyone, please take advantage. Please take advantage of Nova and everything that they offer. I know it can be very difficult and rigorous, but I promise that if you do what you're supposed to do, they are preparing you and you're going to come out ahead. I promise.
Thank you so much, Haley. This was fantastic. I learned a lot here too.
Awesome. Thank you, guys.